The last word.
Thank you, Mr. Chairman. Solving the opioid epidemic requires everyone to work together at all levels, from the federal government down to those on the front lines of this fight. Our continued focus is to make sure our communities have the resources to treat addiction and pain and will save lives. That's why I support Ranking Member Neal's legislation, the Medicare and Opioid Safe Treatment Act. This vital piece of legislation includes my bill, H.R. 5722, the Dr. Todd Graham Pain Management Improvement Act that I introduced with Congresswoman Chu. I want to thank her for her support and valuable input on this critical piece of legislation. The bill is named after my friend, Dr. Todd Graham. He was a double board-certified physician in both physical medicine and rehabilitation and pain medicine who lived and worked in my district in northern Indiana. Last year, I'm sure you recall this, he was senselessly murdered after refusing to prescribe an opioid to a patient. It was his first time seeing her as a patient, and she was insisting on a prescription. He made the hard decision to not give in to demands to prescribe an opioid when it wasn't the appropriate treatment. The patient's husband, who accompanied her to the appointment, became so angry that Dr. Graham felt the need to get out his phone and even record the conversation. If you talk to doctors across the nation, these types of heated interactions are becoming more commonplace. In this case, Dr. Graham's case, 2 hours after the couple left his office, the husband returned and shot him in the parking lot. Dr. Graham prided himself on serving his patients in a friendly and caring fashion. He treated each person individually, taking this time specific steps to treat their issues. His loss has been a heavy blow that is still reverberating throughout my district almost a year. However, Dr. Graham's legacy of compassion and enthusiasm lives on through his wife, Julie, their 2 daughters, and their son, who plan to follow in his footsteps of his father. I would like to recognize Julie Graham here today, who flew out here today to witness this bill's passage out of our committee. This epidemic knows no boundaries. Opioid abuse continues to devastate families and communities like mine. In Dr. Graham's case, addiction drove someone to murder a doctor who was trying to apply the right treatments instead of simply writing a prescription. As we continue to take steps to reduce opioid abuse, we have to do more to ensure patients have access to non-addictive pain management options that provide them with a form of care that is more holistic and less prone to addiction, especially for those with substance abuse or mental health challenges. This bill directs Health and Human Services to conduct a comprehensive review on ways to improve payment and coverage policies related to the use of multidisciplinary, evidence-based, non-opioid pain management treatments for Medicare beneficiaries with acute and chronic pain. HHS would consult with stakeholders, including frontline providers and beneficiary groups, to ensure input is provided from across the medical community. The report would do the following. It would provide an evaluation of potential legislative and administrative changes to allow better access to non-opioid treatments for pain, and an analysis of the FDA-approved medical devices, non-opioid-based drugs, and other therapies for the treatment of pain that are not currently covered by Medicare. This legislation would also direct HHS to analyze the VA and Department of Defense's clinical practice guideline for management of opioid therapy for chronic pain to consider whether the adoption of their pain rating scale would be beneficial to Medicare patients with chronic pain, and requires HHS to develop legislative and administrative recommendations for action on treatment strategies for beneficiaries with psychiatric disorders or substance disorders, those who are at risk of suicide, or those with other comorbidities that require specialty care, appropriate case management for beneficiaries transitioning between inpatient and outpatient settings or between opioid therapy to non-opioid therapy, and outreach to educate Medicare beneficiaries and providers on alternative non-opioid therapies to manage and treat acute pain. As we continue to work toward common sense solutions to the opioid epidemic, this bipartisan bill by Ranking Member Neal will help break down barriers to non-opioid treatments and give doctors better tools to prevent addictions. I support passage of this legislation, and I yield back, Mr. Chairman.
Thank you. Mr. Dog, you recognize strike the last word.
Thank you very much, Mr.